Welcome to Hospitals and Health Networks Daily. I'm H&HN contributing editor Bob Kehoe. For decades now, hospitals have been developing tools designed to improve communication among caregivers. The thinking goes that this will help improve patient safety. That may be, but hospitals also need to focus on creating a safety culture, one where physicians, nurses, and others feel safe speaking up when they see incompetence or inappropriate shortcuts being taken. That's the conclusion from a recently released study by the Association of Perioperative Registered Nurses, the American Association of Critical Care Nurses, and VitalSmarts, a research-based training firm. This study, entitled Silence Still Kills, is a follow-up to a 2005 survey conducted by the same organizations. Among the survey's findings, 93% of the responding clinicians say that 10% or more of their coworkers have taken dangerous shortcuts in providing care. More than 1 in 4 of this group say that they have seen these shortcuts result in patient harm. Meanwhile, more than 80% say that 1 in 10 or more of their coworkers are missing basic skills. Of this group, 37% say a coworker's incompetence led to a near miss or actual patient harm. David Maxfield, Vice President of Research for VitalSmarts, says the data underscore that hospitals need to focus more closely on developing a safety culture.
The key finding of this study is that 85% of the people we studied said they'd been in a situation where one of these safety tools, like a checklist or a handoff protocol or a drug interaction warning system, worked, where it prevented a patient from being harmed. At the same time, more than half of the people we studied said they'd been in a situation where they got the warning from the tool, but they were unable to speak up or get others to listen because there wasn't a safety culture in that immediate environment.
So what can hospitals do to bring about this culture shift? Maxfield explains.
We want a culture where all safety tools are used all the time and where during something like a surgical pause, everybody speaks up and everybody listens in a respectful sort of dialogue. And third, when that doesn't happen, when a safety tool is omitted or people are not being listened to, that someone speaks up about that and holds each other accountable.
And while much of the 2010 data reflect how much work remains to be done, Maxfield says more clinicians are speaking up when they see infractions that could put patient safety at risk.
Nurses in particular are speaking up at much better rates. In the 2005 study, they were speaking up 10 to 12% of the time. Now they're speaking up 20 to 30% of the time. Now that's far from the 100% we need, but it's 2 to 3 times better than what we found in 2005.
Maxfield cites Spectrum Health in Grand Rapids, Michigan, as an example of how much performance can be improved when doctors and nurses are encouraged to speak up.
When we worked with Spectrum Health Grand Rapids, they were a little above the national average, around 60 to 70% compliance with wash-in, wash-out. And within 6 weeks, they were at 90%, and they've been at 95% now for 2 years. The way they did that was with 3 behaviors. The first is wash in, wash out. So every time you go in a patient area, you wash. Every time you leave, you wash. The second behavior was whenever you see someone enter or leave a patient area and you yourself haven't witnessed them wash up, you have to talk to them. And third, when someone does remind you to speak up, you say thanks and you wash up again.
As hospital executives continue to focus on ways to improve quality and safety, Maxfield suggested adopting a 3-pronged approach. First, develop a code of mutual respect. Second, implement process improvements which reduce the stressors that cause disruptive behavior. And third, train staff so they can develop the skills that will enable them to talk about emotional differences of opinion in a more constructive way. These efforts, he says, can save lives. Thanks for listening. Expanded coverage of this survey can be found in the Other Voices column in the April issue of Hospitals and Health Networks or online at www.hhnmag.com.